Have you ever left your healthcare provider's office being told everything looks normal, yet you are dragging to get through your day? You're exhausted, dizzy, cold. Maybe even if you've been told your labs are fine, but your body feels completely off, you're in the right place. We're going to have a great conversation today. This is a podcast or video that might finally explain why you feel the way you do. I have been helping thousands of women, and it starts with your labs. And if you've been told today, like, everything's normal, I'm going to break down how iron deficiency is missed every day, literally every day. So stick with me till the end, because I'm going to share with you what tests to ask for, how you can interpret your own numbers. You can go grab some past ones that you've had if you're listening to this now, and some tips that you can do if you find that you are deficient. So here's the truth. Most healthcare providers only check hemoglobin, and that's how they rule out anemia. But that is the last stage of iron deficiency, not the starting point. Ferritin, which is your iron storage tank, is what you need to be looking at. And you can be deeply depleted and still have, if you're watching me, air quote, normal labs. I want you to also go look at how big that range is on your lab sheet. It is huge. It is actually quite ridiculous, but whole nother conversation for another day. Why is traditional lab missing this? Why? Because most conventional iron panels are looking at hemoglobin or hematocrit, or the provider's only looking at that. Again, also because the range is huge and they're treating lab ranges, not you, the patient. A whole nother rant for another day. But ferritin is not taken serious enough. It is rarely even tested unless you're asking for it, but it is the most sensitive early marker of the symptoms you're having to see if they are related to your iron levels. Are you iron deficient? Women are extremely vulnerable to this because menstruation, endoadenomyosis, pregnancy, postpartum, even gut absorption issues. So if you have some gut issues going on and you're like, I'm taking iron, it's in my prenatal, etc. I'm taking it and I'm still not getting better. Let's talk about gut health. Let's look at some symptoms. Even if you were told your hemoglobin's fine, these are real and really dismissed at the time of recording this, which is why I'm so passionate about it. I'm going through iron infusions. Might be why I have to have found a new healthcare team at my office, because my symptoms were super dismissed for years. But fatigue, exhaustion. Again, you're resting, you're doing all the things, you're super fatigued. Dizziness, lightheadedness, especially with bending over, repositioning, going up steps, cold hands, feet, you're freezing. You're wearing a sweatsuit to bed like I am. I'm wearing cabin socks and a sweatsuit to bed. Shortness of breath with, again, activity or heart racing with minimal activity, going up some steps. Is that causing that? Hair thinning, hair loss, restless legs, brain fog, forgetting things, memory, even though you're not at the age where this should be happening. And then it actually can also induce or make anxiety and depression worse. So let's look at, where does this begin in our body? So you're usually told, start an oral supplement, have a nice day, it'll resolve itself. But let's talk about the stomach a little bit. Heme iron is an animal source like red meat, which is better absorbed. For food, sources are usually typically better absorbed, better handled. Then we have non-heme iron, which is plant sources or supplements, and that needs a little bit more support if you're going to take that to be absorbed effectively. And then there's the side effects that come along with a lot of this too. Your stomach acid levels are really critical to this. And are you going to dissolve it? Are you going to utilize it or not? So low stomach acid, which is really common with stress. Are you taking an over-the-counter antacid? We have a lot to talk about there if you are. Do you have SIBO, other gut dysbiosis, gut imbalances going on? These will all greatly reduce your iron absorption. So it ends there, right? So let's talk about gut health in some other episodes here, which we will. Work on your gut health. Number 2, the small intestine absorption process. So iron is typically absorbed mostly in that small intestine, which is the first parts of the small intestine. And it has some key transporter proteins that are needed to move the iron into the cells if that process isn't working, but also constipation, right? So what's going to help with that? Vitamin C. I'm going to break it to you right here. You cannot take it with a cup of orange juice. Not enough. We recommend in our practice, this is your disclaimer, always talk to a healthcare provider before starting a new supplement. We take high dose vitamin C, like 2,000 milligrams minimum with it. Vitamin D, high doses with it to help absorb it and prevent oxidation of it. Empty stomach is best, but we know that's not possible for a lot of you because you can have some GI side effects. But when you eat meat, if you're someone who likes to eat meat, amino acids in the meat can also enhance the non-heme, so the supplementation of iron too. So you could take it with some meat. Now, let's continue our conversation. What is blocking the absorption? Calcium, dairy. Do not take it with those things. Tea, coffee. Keep it away from those things by a couple hours. Legumes, inflammation. If you're somebody who's inflamed, that in itself is going to really hinder the quality of absorption. Now, next step, transportation in the bloodstream. So once it's absorbed, and if it gets to that point, now it has to bind to transferrin. That is the main transportation for iron in the blood. So let's talk about that. Bone marrow, like liver for storage, muscles, cells, all that stuff is happening. If there's anything interfering with that, we have a problem there. Next, we have to store this. That's the ferritin we talk about. Iron is stored in the liver, spleen, bone marrow. Ferritin, that is what we check for that. Ferritin truly reflects your iron reserve. And many of you have been told if those levels are high, that perhaps you have hemochromatosis. Those are very commonly falsely elevated due to inflammation. It's an acute phase reactant. So many of you, again, just overall have a lot of inflammation for various reasons in your body that needs to be worked on that is causing that to be artificially elevated. I see these levels change a lot after endometriosis excision surgery. Is where I see it most. I have 3 patients that come to head. They came to my office. They were told they have hemochromatosis, never had genetic testing for it. Red flag. You need to have genetic testing before you know if you have that. And had excision surgery, and poof, magically after that, their levels now showed iron deficiency. They were off the charts low, but they were elevated before that. So lots of things that kind of go into that, but ruling out inflammation in your body. Then your body has to properly utilize it. So it's essential for things like hemoglobin, which carries oxygen to your red blood cells. But do you see how that's like number 5 on our list here? By just having a provider check your hemoglobin and hematocrit, red flag. So that is the last part of iron deficiency. Things like myoglobin carry oxygen to your muscles. And then enzymes are involved with neurotransmitter production, detoxification, things like that need iron as well. So if you're deficient in iron, you can see how this is the whole body, not just one part of it. Oxygen, fatigue, shortness of breath, metabolic, brain fog, low energy, feeling cold all the time. So it's not just one system. We got to be looking at your digestive system. Immune system, are you chronically inflamed for some reason? Is your immune system off? Liver, how's your liver that stores it and produces transferrin? We really underestimate and don't take the liver serious enough too. Hormones, estrogen, progesterone imbalance affects heavy periods. What do we need to do to regulate your cycles? How can we slow down those heavy cycles, which are leading to that? Thyroid, that's a hormone, fun fact. That will affect cycles too. But also, if you're in my coaching program, you have learned all about thyroid dysfunction and how you need thyroid hormone to properly absorb iron and how you need iron to properly produce thyroid hormone. They are like hand in hand here. We need to figure out why. Postpartum recovery. Wow, if you were iron deficient in pregnancy and no one checked it postpartum, shame on them. What? All of you were getting iron infusions. Like, it's just crazy. Pregnancy in itself will typically lead to iron deficiency, especially if you went into pregnancy with heavy cycles or iron deficient before. I digress. GI disorders. I tend to see vegetarians or vegan diet individuals be low in this. Chronic stress. Raise your hand. My hand's up. Inflammation, poor digestion, long-term antacid use. If you're somebody who's on antacids, yikes. We have to talk about that because you're not absorbing a lot. You can't be on antacids taking a bunch of supplements. Like, they don't absorb well. Ferritin, let's talk about that. Again, I could have a whole episode just on ferritin, but in our practice, we look for a goal of 100. So go grab your levels. Let's take a look at that. Anything under that, especially under 50, is where we're going to start to feel awful, like legit awful, and have hair loss and all of these things going on. Ferritin is also an acute phase reactant. So again, remember, it can be falsely elevated during times of illness or inflammation. If those levels were checked during a time like that, kind of make note of what was going on during that time. I want you to advocate for a full panel testing. Ferritin, serum iron, your total TIBC, total iron binding capacity, transferrin saturation, not just this hemoglobin hematocrit, B12, folate, vitamin D. They're besties. This all goes together. How can you replenish this on your own? If you're into meats, go for it. Red meats, organ meats. We talk about beef liver. You've probably been told to take some beef liver, but liver supplement, a hack if you want to get real crazy, is have a butcher mix some beef liver in with your beef. I know you're probably all cringing right now, but I'm told, I haven't done this yet. Myself personally, I'm told by patients you can't taste it. And then they will use that pound of beef to make meatballs or something on their own that they eat. So fun fact for you, but spinach, pumpkin seeds. If you're going to do iron supplements or you have, consider a liquid. If you didn't do well with a capsule, finding a really high quality brand that's gentler for absorption. And then taking that iron away from your other supplements that might have calcium in it, dairy, coffee, teas, pairing it with high-dose vitamin C. Take your vitamin D with it. And then root cause. I'm all about, if you've been listening long enough, I'm all about the root cause here. What's your gut health doing? Fix those periods. Do you have SIBO, celiac, something else going on, thyroid disorder that is not being fixed? Like, we have got to work on the root cause. And understand, I want to validate for you today that those missed symptoms or dismissed hair loss, anxiety, brain fog, cold intolerance, brittle nails, things like that are real and we can reverse them. We also need to be taking, again, go look at your labs. What is your ferritin doing? But we've got to be catching this soon. Let's stop those heavy periods. Let's take care of you postpartum sooner. If you're an athlete or somebody who is a high trainer or vegan or vegetarian, let's bring in some of their supplementation now. Let's cook with a cast iron skillet. I promote a product a lot, I don't, for no reason, just because it's a good way to get iron in. This thing called an iron fish. It's not really a fish, but you can throw it in with your food. So there's some hacks and things you can do as well. Go grab your ferritin levels. Tell me in the comments if you're comfortable, if you're watching on YouTube, what are your symptoms? What are your numbers? And if it sounds like you and you're just done being dismissed, I'd love to help you. Let's get on a call. Let's get you answers and feeling good again. I will share my iron infusion journey with you at time of recording this over on Instagram. I have been sharing the symptoms I'm having, my iron infusions. You do not have to feel like this forever. It is so treatable. Iron deficiency is fixable if found, right? And how many providers are finding this? Not many. So now that you know what to look for, what to ask for, some things you can do today to take this in control of your own hands, go get those labs drawn, go grab your past lab levels. There's hope for you if you have iron deficiency, I promise. Drop me some comments. Let me know how you're doing. I'll see you in the next episode.